Hello everyone. So today we're going to discuss about pemphigus. Alright, so sometime or the other we must have listened to this word, right? Pemphigus. Yes, Pemphigus vulgaris, right? We usually listen to this one. Today we learn what this is and what is all about. Yes, and first of all let me just give you a brief introduction, and what are we going to do? We also want to have a classification as well, right, about the diseases and what antibodies are made each of the pemphigus group, right? And that point is important. Alright, so let us just start. So pemphigus, this group is an autoimmune condition, right? Autoimmune condition, and blisters which involve the skin, mucus and the membrane. Alright, blisters involving skin and mucous membrane. Alright, so that is all for the definition part. Yes, and now let us go on to the classification, right? Okay, alright, so first of all we just straight away have the pemphigus vulgaris one, right? So the vulgaris we learned before, right? So vulgaris is the most common one. Yes, and the next one is the pemphigus foliaceus, yes, followed by pemphigus vegetans, pemphigus erythematosus and the paraneoplastic pemphigus. Alright, but first of all, because this is an autoimmune condition, there is involvement of some sort of antibody, right? So antibody against what? That is the question. If you answer that, then all the life is set, right? Yes, okay, fine. So this is one image we have here, alright, describing the cells in which we have the cells are interconnected, right, via something. This something is known as desmoglein. Alright, in pathology we learn that these are the desmoglein, these are the cathedrons, right, which connect cell to one and another, right? Okay, in the dermis. Okay, fine. So there are total of 4 types of desmogleins. Alright, so and the antibodies are made against these ones, but which one? First, second, third, fourth, which one? Right, that is the question. Alright, so as we go ahead, I will also give you a limitless trick to remember. Alright, so let us go on. Okay, fine. So pemphigus vulgaris, so the antibodies made against desmoglein 3 more than 1. Okay, the next one is pemphigus foliaceus, there is desmoglein 1. The next one is vegetans, desmoglein 3. Yes, and this is desmoglein 1 in erythematosus, and in the paraneoplastic one multiple desmogleins are involved because there is a whole systemic involvement. So alright, fine. So now the thing is, like, how can we remember like which desmoglein is related to which pemphigus group, right? Which antibody is related to which pemphigus group? So if we just see clearly, right, over here we just mention it out, right? V 3. Alright, so wherever we see 3, wherever we see V, we just have to mark it 3. Alright, so let me just mention this, right? Okay, so this becomes a limitless trick. Okay, fine. So this is one of it. Okay, wherever we see V, there will be 3. Okay, V3. Okay, fine. So that is one of the trick I used to remember. This is the exact same one. Okay, fine. So now we are very well aware, right, of the presentation, right? We know the classification, we know which antibodies are involved, and what are the insights about the pemphigus group. Alright, so let us continue our discussion further about the pemphigus vulgaris, right? So this is one of the topics we'll talk more about. Alright, as you can see in the image as well that there is mucosal involvement. Yes, we will read this point more in a while. There is mucosal involvement, and you can see there are blisters, very extremely painful blisters, and there are pus. So lot of the dermis is involved. Alright, fine. So pemphigus vulgaris, so by the limitless trick we see V, so we mark 3, right? Let me just take yellow. We mark 3, right? 3 more than 1. Okay, vulgaris 3 more than 1. Please make sure you remember this. I'll just mark it out, mark this point once again, right? This is important. There is mucosal involvement, as you can see in this image as well, right? This is starts by the oral mucosa followed by the cutaneous lesion, right? So this followed by this. Okay, the blisters are flaccid, yes, and intraepithelial layer is involved. Interesting finding is the age. The age group is 40 to 60 years old and the incidence is same in male and female. Okay. Alright, so diagnosis, yes, we'll have to do a skin biopsy. Yes, why? Because there could be a lot of overlapping, right, in this. If I show you the image directly, maybe somebody can think, okay, fine, this is Stevens-Johnson syndrome. Okay, fine, this may be toxic epidermal necrolysis. Okay, so what to do? In the two things we mentioned, I mentioned like there will be some offending agent. In our discussion of the Stevens-Johnson syndrome and toxic epidermal necrolysis, we were very clear that there was some drug or there was some history of some viral infection or something, right? And the patient went into a mayhem. And in this, there will be no history of any offending medication or such. Alright, so that is important when we see the image. Alright, okay. Continue. Let's continue on the biopsy finding, right? So we will have, if we take a biopsy and we do the direct immunofluorescence, yes, we will find IgG and C3 complement depositions. Alright, so let us just write that point. IgG and C3. Alright, so we have that. This is very, very important. I will mark this as a start point. Okay, that is done, right? So the biopsy findings, and even in that we have the immunofluorescence finding. We had IgG3 and C3 complement deposition. We have to make sure we remember this. Okay, so let us continue with the presentation. If we just remember this image, yes, so there was oral mucosal involvement, yes, tended to touch, definitely, and if necrosis sign is positive, because the moment we just try to push the skin, right, with a tangential pressure, the skin will just slough off, right? That is something, and it definitely leaves erythematous lesion, which is very painful. Okay, let us go on to the complications, right? So the secondary bacterial infections, yes, we can have dehydrations, other complications, and scarring. Treatment we have to give, because this is an autoimmune disease, right? The only thing we have option is we can reduce the immunity of the patient, right? So this will be, we have to give systemic corticosteroids. All right. Okay, all right, so that is all about that. And for the adjuvant therapies, yes, the word adjuvant I explained before, like something we add on, right, to the main treatment. This is not the main treatment, this is the add-on treatment, right? We add 𝗧𝗲𝗹𝗵𝗺 and mycophenolate mofetil. All right, these things are there. All right, so now we are done with this. Now let us just take this opportunity. We will do a quick revision for the whole thing, for whole pemphigus. All right, yes, so let me just okay, all right, so this is a revision part, quick revision of pemphigus. First of all, we learned this is an autoimmune condition. Okay, this autoimmune condition, and there is antibody against the Desmoglein, right? Desmoglein. Okay, all right, and the Pemphigus vulgaris, right? I'm just going to write a short form, Pemphigus vulgaris. That was the Desmoglein 3 more than 1. All right, and the limitless trick we learned was wherever there is V, there is 3. So Pemphigus vegetans and Pemphigus vulgaris, we mark 3. Okay, that trick was there, that we have to mark 3, and other we just mark it 1. Okay, we go ahead and we see about the lesions, right? We saw the presentation of the patient, and moreover that we had the immunofluorescence finding, right? So it was IgG and C3 complement deposition. Complement deposition. In what? In immunofluorescence, right? Immunofluorescence. Okay, all right, so that was there, and we went ahead with the treatment plan. Yes, in the treatment we just offered corticosteroids, yes, and we gave 𝗧𝗲𝗹𝗵𝗺 and Pemphigus. Alright, fine. So I guess we did summarize the topic of Pemphigus. Yes, I hope this was a very good discussion. Yes, and please try to just focus on the important points, the star point. There were 2 star points in this whole topic, and that's all for this. Thank you so much for listening.